everybody for joining. Today we'll be discussing preparing for the No Surprises Act, the provider directory requirements for January 2022. This is a part of the midday download brought to you by CAQH. Next slide, please. On the call is myself. My name is Warren Chang, Senior Business Development Manager at CAQH. Also with me is Kia Shah, Senior Product Manager, Development Manager at CAQH as well. Next slide. So a little bit of background about CAQH. We are a nonprofit alliance of health plan and trade associations. Everyone that you see here on the slide sits on the board with us and helps develop the solutions that we bring out into the market. Next slide. Today we'll obviously be focusing on the direct assure solution, but we do have other solutions that are built from ProView. The two solutions I do want to highlight is Verified and Sanctions Track. So Verified is our PSV solution. We do waive the provider fees for all the providers that you run through Verified, and we also have a Sanctions Track solutions that monitor state licensing boards, OPM and OIG, Medicare, Medicaid solutions, and SAM. Outside of our provider data management solution, we do have a COB solution. If any of these solutions are of an interest to you, please don't hesitate to email me and we can set up a call. Next slide. I'm going to pass it over to Kia to talk about the landscape.
All right, so how did we get here? From the Post-Affordable Care Act approach to improving provider data directory accuracy. Improving the accuracy of provider directory data has always been a challenge. However, looking at the landscape post-ACA, we noticed a large uptick in the number of consumer watchdogs filing lawsuits due to data inaccuracies, which snowballed into federal and state guidance, requirements, and legislation. And so in 2016, CMS issued guidance for Medicare Advantage plans that they can be fined for provider directory errors. Next slide, please.
What we know. Next slide. So from the provider's perspective, pain points are going to be brown abrasion. Multiple plans have similar inquiries and have internal teams and outside vendors making phone calls, emails, gathering pretty much the same data with some variation. Submitting the data can be confusing for providers as well, since each plan has their own plan of attack on how they want to consume the data. On the plan side, they're spending a lot of internal resources and paying out high costs to vendors and still getting back questionable data. Next slide. So this slide kind of shares the various approaches from each health plan. As you can see, the highest number of the main approach is faxes, to 38%, followed by phone calls, emails. If you take a look at how this information is being gathered, faxes and phone calls can be slow, especially if there's a back and forth between the health plan and the provider. So we do want to help clean that up and make it quicker. Next slide. As mentioned earlier, the cost of directory is quite expensive. CAQH did a study earlier where we calculated the average cost to clean up per provider record is around $12 per provider per year. The slide above here shares the annual cost of provider directory maintenance, which can be about $2.75 billion. In 2018, we conducted a national survey of over 1,200 physicians and found that directory maintenance costs providers on average $998.84 per month. Next slide. Kia is going to discuss the No Surprise Act.
The concept of No Surprises Act isn't new. There are numerous states that have enacted guidelines, legislation, etc. to improve the accuracy of the provider directory data. CMS has rules for Medicare Advantage plans, and various states have their own state-specific rules. But now it appears that there will be requirements for the commercial markets as well. And while there has been some improvement in the data quality of directories, it is incremental at best. And so with the provisions in the No Surprises Act regulations, there are some requirements that health plans and providers need to implement by January of 2022. The health plan requirements are that they need to be able to maintain a database of provider directory information, be able to launch a verification process to update provider directory information quarterly, implement a process to remove unverified providers, execute a process for updating provider directory information within 2 days of receipt from the provider, Implement a response protocol that ensures a provider's network status request is responded to within 1 business day and communication is maintained for 2 years. In addition to that, there are also some post-balance billing protections as well. Next slide, please. Providers also must ensure the timely submission of provider directory information, specifically when provider begins a network agreement with a plan with respect to certain coverage, when they terminate an agreement, any material changes to the content of the provider directory information, and any other time or elements determined appropriate by the Secretary. Next slide, please. There are certain miscellaneous provisions as well, which NSA does not preempt state law if it does not interfere with the express provision. There is also onus on the patient to prove that they received inaccurate provider directory information. There are no specific penalties guaranteed by the NSA for provision violation. Next slide, please. There have been interim final rules instituted, first one being in July of 2021 that mentioned that plans must implement the provider directory provisions using a good faith reasonable interpretation. The guidance to that first interim final rule was released in August of 2021 that had guidance regarding that mentioned a reasonable interpretation of the provider directory provisions should be implemented until an official rule is released in or after January of 2022. There was enforcement discretion that would be applied to non-compliant plans if in-network cost sharing is imposed in the event the patient receives inaccurate provider directory information. The second interim final rule, released in September of 2021, established a process for investigating violations of the No Surprises Act, patient protections, and taking enforcement action. It increased transparency of air ambulance services through new disclosure requirements on any plans or issuers and air ambulance providers. It also required certain insurers to disclose to enrollees and report to HHS any direct or indirect compensation provided by the insurer to an agent or broker associated with enrolling individuals in such coverage. A third interim final rule, also released in September 2021, expanded the description for self-pay individuals to include patients who have insurance but do not want to file a claim. It established open negotiations and the Federal Independent Dispute Resolution for out-of-network payments processes. Next slide, please.
Okay, thank you, Kia. So we conducted a poll earlier, next slide. And when we found what was most concerning to health plans was implementing a process to remove unverified providers quarterly. The other top issue was executing a process for updating provider directory information within 2 days of receipt from the provider. Next slide. So how is CAQH assisting health plans in meeting the NSA requirements? I'm going to let Kia jump in.
Yeah. So in response to the guidance and interim rules, we have enhanced our current provider data directory improvement solution called Direct Assure to assist plans and providers in meeting the directory requirements. We anticipate additional guidance for the No Surprises Act to occur in January 2022 or shortly thereafter. Currently, health plans are required to implement provisions using a good faith, reasonable interpretation of the statute. The legislation does not preempt state laws or regulations, so states that require plans to update and verify provider directories more frequently than quarterly can continue to do so. In the interim, Direct Assure addresses the current requirements highlighted in the legislation by updating the outreach notifications or to alert providers to confirm provider location data every 90 days, as well as provide the provider practice location screens to display a date stamp of the last time the information was confirmed. Next slide, please.
Okay, so how are we at CAQH addressing NSA through our direct-to-share solution? Direct-to-share will help address the pain points mentioned earlier, like outreach to providers, provider friction, and reducing the data administrative burden, all the while cleaning up the provider directory. For those that don't know direct-to-share and how it works, health plans submit roster and practice locations. That information is then loaded into ProView. From there, providers will reconcile practice locations and answer location-specific questions. Once that's completed, that information will then be sent to health plans so that they have actual information of what they should suppress and what they should publish. CAQH will also send out quarterly outreaches to providers to make sure that they are updating their directory. Next slide. Launched back in 2016, direct-to-share builds from ProView. We have rostered over 1.8 million providers through our direct-to-share rosters and outreached to over 17 million providers through emails and made over 1.8 million phone calls. The beauty of direct-to-share is that from the provider's perspective, this is all just ProView, which means providers know who we are and are very likely engaged. We found that over 80% of our providers have responded after one email. Next slide.
Right.
Kia will explain some of our recent updates.
So in addition to the processes that we're using to improve data accuracy, we will also increase our provider engagement methods and alert them to confirm their practice location data at least every 90 days and display a date stamp of the last time the provider's practice information was confirmed. Next slide, please. So here's an example of an outreach email that will be circulated to providers to make them aware that they are required to update and confirm their practice information every 90 days, even if there has been no change to that practice location. The cadence of this email is every 90 days, regardless of provider action. Next slide, please. For added transparency and reporting, we've added highlights on the provider practice location screens, highlighting the date the practice location information was last confirmed. A confirmation means that a provider either made edits, verified and saved practice location information, or they confirmed that there were no changes to location information, or they attested to their full profile, or they added a new location record and saved all required fields. If a provider's practice location record has not been reviewed or updated in the last 60 days, they will be alerted to indicate if the location information is still accurate. The confirmation date will be updated upon clicking the No Change button as well. Next slide, please. The health plans can now will be able to access new, updated, confirmed, but unattested, attested, or archived provider practice location information via the Direct Assure portal and via the API. The provider's most recent confirmation date for each practice location record will also be displayed on the provider details screen on the portal. Next slide, please.
Okay. Next slide after questions. So again, thank you for tuning in today on the Midday Download. If you have any questions or want a demonstration of direct-to-share, feel free to contact us. Our contact information is listed on the next slide. Next slide, please. If you'd like a copy of this recording, a link will be circulated later this week to all the attendees. Thank you and have a great afternoon.